Fast exam in trauma, an engaging dive into ultrasound in emergency medicine. Hey everyone, welcome back. Today, we're diving into something every trauma team needs in their toolkit. Yep, you guessed it, the FAST exam, that stands for Focused Assessment with Sonography in Trauma. So, what is it, and why does everyone in the emergency room seem to talk about it all the time? Picture this: a patient rolls in after a car accident, and the clock is ticking. The FAST exam is a super quick, bedside ultrasound doctors use to check for life-threatening problems, like bleeding in the belly or around the heart, or even a collapsed lung. If you've heard the term EFAST, that's just an extended version where they also look for things like pneumothorax, or collapsed lungs. Let's break down what FAST actually does in trauma care. Detects internal bleeding fast. The FAST exam can show if there's blood in the abdomen. Think injuries to the liver or spleen, or in the sac around the heart, which, by the way, can be deadly if not caught right away. Checks for cardiac tamponade. That's blood building up around the heart, making it tough for your heart to pump. If they spot it, doctors can jump straight to life-saving procedures. Expanded look for chest injuries. With EFAST, they can spot air in the chest cavity, a sign of a pneumothorax. Super important in chest trauma. Speedy triage for unstable patients. If someone's blood pressure is dropping, a quick FAST exam helps figure out if it's from belly bleeding or something else. And if it's positive for free fluid, they're off to surgery. Stat: no needles, no radiation. You can repeat the FAST as often as needed, and it only takes a few minutes. No harmful radiation to worry about. Guides decisions on the fly. If the exam is negative but the patient's still unstable, the team knows to look elsewhere for trouble, maybe the pelvis or the chest. But hey, it's not all perfect. There are a few things to keep in mind. FAST can miss injuries in the retroperitoneal space, hollow organs, or if there's only a little fluid. It really depends on the skill of the person doing the ultrasound, so some training is a must. And remember, a positive FAST usually means more tests or surgery, and a negative FAST doesn't rule everything out. Now, according to the ATLS guidelines, that's Advanced Trauma Life Support for those new to the emergency world. When do we actually do a FAST exam? Here's the rundown. Unstable trauma patients. If someone's been in a bad accident and their blood pressure is low, FAST can help find out if there's bleeding in the abdomen or around the heart that needs immediate surgery. Suspected cardiac tamponade. After a chest injury, if there are signs like low blood pressure, neck veins bulging, or muffled heart sounds, the FAST checks for blood around the heart. Chest trauma. With the EFAST, doctors can quickly check for collapsed lungs or blood in the chest cavity. Serial monitoring. Even in patients who seem stable at first, the team might repeat the FAST if the patient's condition changes. Pediatric trauma. Yep, the FAST is used in kids, too, since it's safer than a CT scan and doesn't expose them to radiation. When might you skip the FAST? Well, if the patient is stable with a low-risk injury, or if it's clear they need surgery, like their intestines are already coming out, yikes, then you might not need it. And in isolated head injuries, FAST isn't really helpful. So, let's wrap up. The FAST and EFAST exams are ultra-important tools for trauma teams. They're quick, non-invasive, and can literally save lives by guiding emergency interventions. But they're just one part of the bigger trauma assessment puzzle, always used alongside clinical judgment and other imaging if needed. If you liked this breakdown, hit that like button, and don't forget to subscribe for more practical medicine talk. Got questions or want us to cover another emergency medicine topic? Drop it in the comments below. We love hearing from you. Thanks for tuning in, and we'll catch you in the next episode of the Everything Surgery podcast. Dissect the Extraordinary.